talking about neurofibromatosis. So neurofibromatosis is a genetic disease of the nervous system. It can cause tumors to form in the brain, spinal cord, and nerves. And since it's a genetic disorder, commonly with this condition, it's passed down from parent to child. And so the tumors that which develop are usually non-cancerous, but then they can become malignant. And it's a fairly rare condition in the United States. Fewer than 200,000 cases per year are reported. Now, there's three types of neurofibromatosis. Type 1 or NF1 causes skin changes and pigmentation. As seen on the picture in the right, there are a bunch of darker spots on the back. And if there's more than 6 of these spots, it's usually an indication of type 1. And it's a growth of also tumors along the nerves. It begins in early childhood. And most adults develop neurofibromas, which are tumors right underneath the skin. Now, some signs and symptoms are high blood pressure, short stature, unusually large head, or spinal irregularities like scoliosis. Now, type 2 is a little bit rarer than type 1. It's a certain type of tumor, which is called a vestibular schwannoma, and it develops along the nerve from the inner ear to the brain. And as seen in the picture on the right, that is a diagram of where the tumors usually form. And they usually appear around adolescence to the early 20s. Some early symptoms because of where the tumor is hearing loss, ringing in the ears, or trouble with balance. And depending on the area of growth, it can also cause cataracts, weakness in arms, and fluid buildup in the brain. Now, the third type is called schwannomatosis, and schwannomatosis is the rarest type of fibromatosis, and it is a type of tumor called schwannomas which grow on the nerves, and specifically around the Schwann cells, and it causes them to grow uncontrollably and form tumors. Now, a specific and very unique feature of schwannomatosis is a very large chronic pain, and it can affect any part of the body and can be mild to extremely hard to manage. And as seen in the picture on the right, it is a schwannoma forming on the spinal cord and usually appears in early adulthood, and surprisingly life expectancy is normal, but it's completely different from type 2 only because specifically type 2 has the vestibular schwannomas as mentioned before, and schwannomatosis almost never has the type of tumor. Now, cures and causes. So there is no cure for neurofibromatosis, unfortunately, but treatment can definitely help. So within all three types of neurofibromatosis, it's usually a mutation in a certain type of gene, which makes a protein which acts as a tumor suppressor. But tumor suppressors keep cells from growing too rapidly or dividing, but if there's a mutation, it can definitely cause these cells to grow out of control, and without it being regulated, more tumors are likely to grow in the body. So that is neurofibromatosis, and thank you very much for watching.